Hello, everyone. My name is Jeffrey Walton. I'm editor-in-chief of Chain Drug Review. Today, I'd like to share with you highlights from a recent roundtable discussion that we held with leaders of the retail pharmacy industry. This year, the talk inevitably centered on COVID-19 and the industry's response to it, but we also spent a good deal of time talking about the future of the pharmacy profession. The insights are compelling, and I think they have a lot to say about the direction of healthcare in America. We begin with Steve Anderson, President and Chief Executive Officer of the National Association of Chain Drug Stores, who talks about some of the challenges that the industry faced in light of the emergence of COVID.
Our big issue obviously was to work, and we worked very closely with NCPA, but work to create an environment where you can do what you need to do on behalf of the American people. And we were very aggressive. We came out swinging pretty dramatically, going to the states and reducing regulatory barriers. We actually launched an ad that you probably saw called Rise, as we call it. It had these historical pictures of pharmacies and times of challenge in the lives of our country and how pharmacies were always there. As we said, lights on and doors open. We had lobbied really hard to get HHS to declare under the Public Readiness and Emergency Preparedness Act, the PrEP Act, that authorized licensed pharmacists to order and administer COVID-19 testing, tests that have been approved by FDA. And we still had some resistance from some states. State laws were preempted by the federal government in terms of what we needed to do. So we'll get into this, I'm sure, later, but what we've been doing since that time to further reduce the regulatory barriers. But we're really focused right now on the vaccines and making sure that our members will be able to administer the vaccine when and how it's done. It's a very complicated issue, and I don't have to tell anybody on this meeting how complicated this is going to be. But I think this is just another opportunity that pharmacy can really shine and do some pretty incredible things for the American people.
I think that the COVID pandemic has reinforced the essential nature of pharmacies. So we were officially designated essential businesses, and in many cases, pharmacists have been designated as essential healthcare workers. So I think the pandemic has further underscored what we in this world, in the pharmacy world, have been saying all along, but it's put us on a much bigger stage to show the importance of pharmacies and pharmacists. And I think that essential designation is important. I also think part of the backdrop for going forward is that we've learned the hard way that, speaking of essential, that gratitude is fleeting, gratitude is short. We learned that with Part D, when Part D rolled out back in 2006, which was a disaster, but pharmacy saved it. And, we were able to, have some afterglow with saving Medicare Part D in the form of prompt pay, but yet a few years later, we get pharmacy DIR. So the appreciation that pharmacies and pharmacists are receiving is well-deserved, and something that we all have to, and it sounds a little bit shallow in this pandemic situation, but something we have to take advantage of as an industry to really advance pharmacies, advance pharmacists, and help them practice at the top of our license so that patients benefit.
Pretty much across the industry, we started just collaborating that much more so that day-to-day practices with pharmacy was consistent. What was different for pharmacy than every other retailer that's out there is that we're an essential business. And I think we said it earlier, it was critical that we were open. And so we needed to figure out those safety protocols really quickly and what we needed to put in place to be able to support that. And so once we got that foundation set, it was much easier. We also had to activate a lot of we accelerated a lot of our efforts, maybe from a digital perspective, communication, just educating customers about the fact that how they can stay safe. And so it was pretty much, I would say, 10 years worth of work all in about 2 to 3 weeks, and things were changing on a day-to-day basis. And so the level of communication was critical during this time. We were communicating on a daily basis, internally, externally, and to our frontline providers, and providing them confidence that we were in conversations with the CDC on a daily basis, just to ensure that we were protecting their safety and our customer safety.
The humanitarian kind of motivation of our pharmacists is overwhelming. From the time that we put out a volunteer form to say who wants to volunteer to show up on a parking lot and test for COVID, within 24 hours, we had over 600 pharmacists that had said, I'll volunteer to go do that. And I think that just shows the profession and the character, how people in this profession want to help people. And that's what they signed up to do. And they've shown how they can do that. The other thing is just the access. As you think about the healthcare ecosystem, pharmacies provide that access in every community to be able to be that point of care.
One is, how do I keep my staff safe and myself safe? Number two, how do I serve the community, as David said so well? But there's a third element, is how do I transform my business to now accommodate and serve that community in a different way, right? So, it isn't the patient walking in through the door anymore. It's the patient you're communicating over a video or telephonically or through text, or they're getting their medication only through the drive-through or only at curbside. How do I help them get products? So I think there was a three-prong issue that certainly from an independent channel that they were, and Doug can speak to this, that they were concerned about, is not only do I want to keep my folks safe and myself safe and the patient safe, I also want to serve the community. In many instances, many of these independent drugstores are the only provider in town. There is no other provider. And so they want to serve the community extremely well. But then the question is, hey, I have to sustain my business. I have to keep the cash flow going. How do I do that, knowing full well that many of the health plans are switching to a 90-day fills and encouraging 90-day fills? Now I have to carry more inventory. That cash may not come back for months on end after the reimbursement actually gets paid, right? So that's the balancing act that certainly our pharmacy owners were going through.
I don't think a lot of people necessarily realize how many of these small business independent owners did have to shut their doors, right? And so the only option was drive-through, if they had one, or curbside. So it was a fundamental change in their business model and their workflow. And so that was a big challenge, and certainly helping them connect with their patients digitally was key. I think one big advantage that a lot of the independents had through this is already the established home delivery model. That's something they do every day. So that wasn't necessarily that much different. They certainly had to be much more careful in those home deliveries. The workflow impact, certainly the concerns about staying open when their front doors are shut, all created those challenges. But again, they rose to it in heroic ways, just like the entire profession did, and a lot to be proud of. And they continue to work through that. We still have a decent percentage of our locations that are still curbside only and drive-through only.
I think we also helped with the chaos in the misinformation or lack of information, and even the interpretation of information, because it wasn't very clear, and we all had to pull out pieces of the information that was applicable to retail pharmacy, and it wasn't clear and carved out nice and neatly for us. But I think we all have playbooks now, and we are all prepared for any pandemic that hits us at this point in time. So, kudos to all of you. And I do completely understand the power, if you will, of our pharmacists and how they influence patient care. And to watch all of our pharmacists step up and embrace this opportunity without us really having to tell them or guide them, or we were all in our way creating policies, procedures, tools, but they all stepped up in such a caring and empathetic way that just made me even more proud of the profession, because that was authentic and that was true and that was who they are inside. and it's what makes the profession of pharmacy so special. And we did maintain all of our hours. Our teams were really wanted to be participants in the community. We didn't close any stores early at all. We may have had a few based on very select area issues. And our retail side of the business did really well, which just showed how much value, that our boxes and retail pharmacy means to the community to serve them in a safe way. So, it's been an interesting dynamic, and it continues to evolve. There has not been a trend yet. I continue to look at the business, and I can't put my finger on what's going to happen. Whereas historically, for us, outside of some major issues, you could pretty much predict what your business is going to look like, at least for a fiscal year. And I think this pandemic has definitely been challenging because there aren't very consistent trends that we're seeing. And that's all based on the pandemic and what happens in any given state at any given time. And it opens, it closes, it's green, it's yellow, it's then red again. So, kind of navigating through all those barriers and all of those hurdles has continued to be a challenge.
I relate to her comments about the unpredictability of the business. If you look at just new therapy starts, we saw new therapy starts, kind of decline significantly, and we're seeing the same impact with acutes versus maintenance as well. So, our focus has been just really, gearing up for the fall, gearing up for flu season, and controlling what we can control, keeping our patients adherent, delivering where we can, leveraging our drive-thrus. But, I won't add too much more because I think she covered a lot of it, but I'll echo a lot of her sentiments.
Like many of the retailers, we saw the impact quite immediately. We're grateful that the payers allowed that extra 90-day prescription and understand the reason behind that. But like all the retailers, we got slammed hard and had to really respond. We thankfully are reviewing our products and the product demand quite frequently. And months prior, there was some concern out of suppliers in Asia. We're an American manufacturer, and yet, we're subject, as you're all well aware of in the industry, to ingredients or things coming from different parts of Asia. We have tried to limit our exposure to the extent that we're able to, but we're in the generics business as well. Nonetheless, Upsher Smith really rose to the occasion. But I think then the other piece that we've seen the challenges on are the new prescription piece of this is obviously physicians weren't going into offices. If they were, their patients weren't, and except in extreme acute or emergency situations. And so even though Upsher Smith has a long history of having a virtual sales force that augments its field sales force, it shouldn't be lost on folks, and we should continue to beat the drum that truly the entire supply chain and everyone, I have not heard of drug outs. I have not heard of supply circumstances anywhere through this. And, knock on wood, again, the outlook is strong, at least for our business, for the ingredients to support that. But that truly was, like I say, from day one. And what I'm going to say is day one was even preparation ahead of that, all the way through looking out into the future. It looks like the prescriptions that we're filling are going to go relatively seamless.
Well, Jeff, we certainly see an awful lot of data in our business, and I think some of my data points kind of confirm the trends that we've heard. While we were seeing a number of early refills early on, the early refill rate is only slightly higher now than it was at the pre-COVID levels. So that seems to have stabilized. But I think a lot of our clients are expressing that there is significant concern about patients that may not be getting diagnosed because some of the largest drug categories, the new fill volume there is 40 to 60% below normal levels, which is somewhat concerning on some of those large categories. And then I would say, interestingly, from a digital perspective, participation in digital engagement and programs new participation has been dramatic in the number of consumers, between 50 and 700% increase in those types of programs. And certainly in the grocery, pharmacy, combination categories, they're seeing the people that are coming to them to meet a healthcare need are spending at 4 times the level of people who are not one of their healthcare consumers. And so that whole loyalty and attachment when you're meeting a healthcare need for the patients is definitely very apparent in the data.
With the partnership with drug wholesalers and the chains was spot on. With that collaboration, we had minimal out of stocks, and we had 2 areas in respiratory and diabetes that were impacted. Respiratory because of the nebulizer use being eliminated at the hospital. So we had both a retail stocking situation that as we increased inventory there, but also managing that increased growth at the hospital. And we're trying, like everyone, what is the new norm? It looks like as different states have increased COVID, not only testing, but number of cases, we've learned from where we started back in March and April. So we're not seeing the panic buying in different areas. So there seems to be at least somewhat of a new norm happening, but it really was the collaboration and communication with all of our retailers and wholesalers on how to make sure we got the right product at the right time. We're also seeing new starts drop. We're trying to double down on adherence. Those patients who are already on our products, who are already looking for assistance there from an adherence and compliance standpoint. So at least from a trade perspective, we can't do much to get more patients in, but we can certainly do our best to maintain those patients who are currently on our products.
I think the American people realized how critical pharmacists has played in this whole challenging time. And if anybody has risen up, it has been pharmacy and pharmacists. So congratulations to you all. I think you have a story here that I hope you will continue to tell to the public. The public is seeing it, they're feeling it, but I know this story is not ended, and I think it's going to be a wonderful ending where pharmacists really are get the I guess the credit that they have always deserved and even more. So I do want to say that.
What we're trying to do is support this group. I was doing some math in preparation for this, and I think by end of year will be something like our customer base will be filling 22 million prescription orders a month. So making sure that we get and are able to get out to those sites for routine maintenance, for service issues, whatever the case may be, has been critical. What we're hearing from the industry, whether it's independent or chain, is a real focus on the patient, as everybody's echoed, and how do you want it? Do you want to pick it up in store? Do you want to get it through the drive-through? Do you want it delivered to you via the mail? Do you want it 2-hour delivery at home? How do you want it? So we're obviously working hard and seeing more interest in technology, whether that's in-store technology or central fill technology or mail technology going forward. And one of you, and I can't remember who it was, said something about showing the value of pharmacy. It's interesting. We went through an exercise, Greg Watson and myself, last week to unveil a new vision for innovation, which is unleash the full potential of pharmacy. So how do we get pharmacists to be more patient-facing? And we think technology plays a big part of that, because if we can take work out of their hands, the dispensing processes, the insurance claim phone calls, and get them patient-facing for COVID testing, for immunizations, for MTM, whatever the case may be, then we're advancing the profession of pharmacy, which is exactly what we want to do. So hats off to the industry. We're here to support it, obviously, any way we can.
Pharmacy has always been known for its leading role as in using technology, and it's just amazing to me to see how quickly all these different technologies were brought into play. And what I constantly hear and a lot of my work is like it was today at a major VA hospital, is we aren't going back. Okay, the cat is out of the bag. We see that we can do these things. We went into this pandemic with a huge backlog, particularly in our health system customers. And I called some of them and I said, so what are we going to do? Are we going to delay this? And they said, absolutely not. We don't want to delay it because we know it isn't going to get better. If we need it worse than ever. And so our people, we have a lot of different skills in our organization, obviously, and about 60-70% of them could just immediately start working at home and honestly work better than they ever did. So whether it's mobile dispensing, robotic filling, communications, texting, video conferencing, all these technologies are here. And I think it's kind of amazing just how effective they have been, both in terms of running our own organizations, but also in terms of interacting with patients and bringing meaningful support to them in their quest for better health. So it's that genie isn't going back in the bottle, nor should it. It took something to really let it out, but now that it's out, it's just going to expand. I think it's very exciting.
On that, I mean, from sometimes small business owners might be a little more hesitant or, for lack of a better term, maybe delayed in adopting existing technology, right? And what we've seen, a couple of years ago, we launched a pretty heavy digital platform for the independents, and the uptake of that was really good, but it certainly accelerated through the beginning of COVID. And what we noticed was a transformation in how that technology is being used, and we're really talking about digital communications and outreach and patient engagement. And many of the independents, their digital platform was I put my store up on my personal Facebook. Or I may have linked it to my personal, Instagram or whatever. And we worked really hard to get that transformation to more of a business approach. And what we've seen is really a more proper use of those existing technologies for true business purposes, rather than kind of that social connection between the store and their current customers, and using it to attract new customers. And they were able to get their unique messages out, to their customer base in new ways that, like I said, previously it was talking about pets and family type things. And then it now is talking about, real ways to make that connection stronger.
It's not only us adjusting our technology, it's bringing the customer along with us and making sure that technology is so simple to interface with, so that it's intuitive and it brings them along to where there's not a lot of our population may not be as technology savvy as my kids are. Mm-hmm. And so just making sure that everybody comes along with us, and that's the operability for the user, the customer user, the patient, is just as simple as they need it to be at all levels. And so I think that's a big key as well.
Mm-hmm. Anyone else on this topic?
We've always had a robust technology roadmap. I think where it's changed our thinking a bit is, I'll use immunizations as an example. You think about, flu immunizations this fall. We looked at our process and said, gosh, it's kind of manual. We're handing over paper. We're having them sign things. And it's just one example of many that I could give where we've looked at existing processes that maybe weren't high on the radar and said, okay, as we think about this in a new world, how do we streamline this? How do we make this simpler? And we'll have a very refined process for flu shots that will be mostly contactless, as contactless as a flu shot can be. So and then think about things like drive-through and how we operate our drive-throughs today. So I don't think it's changed our core technology roadmap, but it's maybe changed our prioritization of how we're thinking about different initiatives that maybe were a little lower down the chain before, but now are rising to the top.
Mm-hmm.
But I think where pharmacists did a great job, whether it's a chain setting or an independent pharmacy setting, mass grocery, just name the setting, is the knowledge of the patient coupled with use of technology in the right way, right? So just throwing another app out there or throwing another functionality out there is not going to get it done. I think we've said this in previous roundtables that the magic of technology in healthcare is to match up the provider with the knowledge of the patient with technology. And I think the one thing that certainly we are seeing is our pharmacists are actually doing that, is they know Jeff and they're telling Jeff, hey, here's something that you ought to use to make it easier for you even in this pandemic. And so I think the real crux of this is not just throwing a bunch of technology out there to say, hey, we're convenient or we're digital. The real issue is, here's a technology that will make your life easier. Let me show you how to do that. And I think that's where pharmacists played a great role in doing all of this.
We're spending a lot of time, we've got that Symphony software platform that is capturing and collecting a lot of information. And based on, we're seeing this pivot, if you will, an acceleration of the pivot from acute more to non-acute environments and more emphasis on telehealth. And as a part of that, you're going to have more, home tests, you're going to have more home care, and how we go about capturing that information and getting it back in the hands of this group is going to be critical. So I echo that. I continue. That is a big emphasis of what we're working on from a software perspective.
For the remainder of 2020, there's a focus on not just what we accomplished, but how we are going to extend and where possible, make permanent a lot of the operational and pharmacy practice flexibilities that were granted during these executive orders that I talked about that we saw over the last couple of months. We're working to continue to remove some of the existing barriers for pharmacists provided treatments and vaccines. And to the point of your question, really the expansion of pharmacists and technician immunization authority and adequate reimbursement for COVID tests and vaccines. So these are all really important. I'm working as part of something called the Vaccine Consultation Panel that Secretary Azar asked me to work on, and we're meeting with senior people within the government on the COVID vaccine development, which we don't do much about, but we're there in terms of the vaccine deployment. CDC has said we can immunize 80% of the American people 7 weeks faster if we use pharmacists, and we are making that case at every turn right now. That's our top priority.
And so it was April 8th that HHS gave pharmacists the ability to order and administer tests, which, I mean, that's, we wanted to throw up the hands and a touchdown score, because that's something that we as organized pharmacy have been working towards for decades. As it's rolled out, we've seen some of the challenges with it. Rena mentioned several of them. The availability of the tests themselves and the tests that can be used in pharmacies, especially for pharmacists to administer, that's been a challenge. And the payment, getting payment for pharmacies has been a challenge, sorting that out. Plus, there's been a bit of an uneven rollout in states. So those are all things that have to be worked through, but frankly, I'd rather have the opportunity to work through them than where we were on April 7th, the day before we got the ability to order and administer, because at least now we're in the game when it comes to testing. On the vaccine, some of the things have been covered, whether it's storage. I mean, we talked about technology, but just some of the storage devices for at least the early read on some of these vaccines, we're hearing they may be as low as -80 degrees Fahrenheit. And there's very few, that's a lot colder than the temperature in your refrigerator with the ice cream in it, a lot colder. So how will the vaccine be stored? How much time will the vaccine have to be administered once the pharmacy receives it? How will the pharmacy be paid? There's even been a little bit of territorialism with other healthcare providers, surprisingly, during a pandemic that, you know, pharmacy's been having to try to overcome. But I think the net is that pharmacists are in the game. We're being talked about. We're being, you know, considered versus where we were before. So I think that's a major step forward.
Our first priority was to ensure that we secured, as everyone did, enough flu shots. At first, knowing that the demand may be higher as the collide of COVID and influenza, you know, met at some point in time this fall. Interesting though to see, you know, are individuals going to come out for that, and it is going to be critical that our pharmacists are influencing those decisions and highly recommending at every point in time when they're communicating with our customers that how important it is to ensure we relieve the healthcare system of additional pressures as typically are seen during influenza season. So I think our pharmacist role again is going to be critical for the health and well-being of our customers during flu season. We don't know enough about that to truly predict what's going to happen. So from our pharmacist, I don't think that's necessarily a huge concern for them today. You know, we should be pretty far out of flu season or flu immunizations, in my opinion, before something comes to market, even if it is accelerated. So it will provide us some time to step up again and help with the COVID vaccine. And I know NACDS and Steve and his team are doing everything they can.
You know, the public is really sensitive now to the importance of drugs. Everybody's kind of sitting on pins and needles hoping that they come to with the drug. They're paying a lot of attention to this, and that's causing you know, the administration and others to pay a lot of attention to pharmacy. Against that backdrop, there's this issue of so many of our dependence on China and India for our drugs. And there are concerns in that area. As I understand it, the drug Coumadin now is no longer available. And you have to go to generics. And the generics that you get can vary quite a bit in terms of their strength and efficacy. It can vary too much. For even in our own company, we have a lady that is heavily dependent on Coumadin and can no longer get it, and that's a problem. Scriptpro does a lot of work with leading university health systems, and some of those have grouped together in an organization that we're involved in to do spectroscopy testing of these drugs to try to come up with some benchmarks to say, you know, what are we really getting here? I think that now that the public is really sensitized to drugs and also sensitized to our dependence on China and India and other countries for these drugs, I think there's going to be people looking to us to provide some leadership in this area, some independent leadership and evaluation. I think that could be a political trend.
I do think that there's an opportunity for, I keep calling it a retailization of pharmaceuticals. And what I mean by that, obviously you retailers are selling them today, but I think being in the generics business, it may look like other countries where there are branded generics, where someone may prefer to buy a US-made generic pharmaceutical product over an Asian-made generic pharmaceutical product. When you consider the fact, as Doug Long will say, that 90% of the drugs out there dispensed are generic, and AAM says that 90% of those are less than $20. Most working Americans can afford most of their generic medications, and frankly, I think it's 40 to 50% of them are already on high deductible health plans where they're probably getting little to no drug benefit anyway. So there is an opportunity here that I think we continue to talk about it, but I think we have leapfrogged into the American people's awareness of pharmacy and the awareness, I think, of change and their ability to even adapt to it. And I think it isn't, you know, we get so worried looking over our shoulder at an Amazon. I think it could be someone that doesn't even exist today could leapfrog out of this into something that would have some sort of a retail model. But we have to challenge ourselves that thinking oftentimes gets us to try to entrench and dig our heels in and preserve the existing model rather than figuring out how we can throw it away. So I just put that out. I put that out to the group because I do think that the events of these past 5-6 months have set us up for, I think, unprecedented change that the American people are going to be ready for.
Going through the process now of looking at where we're getting our API and looking at to how we can change that distribution model. Challenging, but we are relooking, and we will continue to do that. I think it's that time. It is just simply that time to do that. I'm encouraged by what we are doing and what we are seeing, and the opportunity that AZI has to move and move forward quickly.
Bob, is BI going through the same sort of thought process?
Yeah, and we have been, especially around the API utilization and where it's coming from. But you know, we basically get it from finished goods in the U.S. forward. But there is a lot of people working on that to ensure a safe and secure, you know, product line, and you know, we've been fortunate that we've been able to do that.
Sounds like an approval could be by the end of the year. I think it's been spoken of before. It's how do you get enough production to produce it? Let's just say all three that we're hearing about get approved. How long is that going to take for them? I know that they're doing everything to get up and running, but I would say it's April to June next year that it would be widely available in the best case scenario.
Yeah, I think everything you've seen is best case scenario. You know, it's still a record pace. If they can do it, great. But then I think it's how are they going to allocate that? You know, and the billions of doses that you need. So, and I heard earlier cold chain potentially, you know, minus 80 or whatever. Any of that complicates the supply chain. So. But, you know, I'm sure there's going to be collaboration with manufacturers, and, you know, we'll work it out somehow. We may not know it right now, but when they're available, again, I think retail is going to be a great spot for it. One thing I did want to say when we talked about the flu shots, I don't know if it's a bonus, but we used to do our flu shots at our corporate office. With COVID-19, they're not doing that anymore. So you may have a bunch of employers with pretty big office sites that are going to be looking to send their people to a retail setting for flu shots. So there could be an opportunity there from a volume standpoint.
I think our clinics play a major role in our strategy, in particular, making healthcare local and really delivering healthcare in the communities that we serve. I think we have a very unique opportunity, you know, as we go into the fall, and some of this was mentioned, but, you know, you think about being able to offer a COVID test locally in the community they're in, whether that's through, you know, expanded point of care testing, whether that's just through different treatment options. So I think, you know, as we get into the fall and as we continue to expand and fine tune our testing protocol, you know, we see it as a great opportunity to make sure that for those patients testing negative that are still symptomatic, you know, we have a very easy, simple option for them to get the care that they need to get back on their path to better health.
Walmart Health is a little bit different on the clinic model in that we not only have you know, physicians on site, but we also have dentists. We have full optometry and hearing, behavioral health, and then lab work. And so we have a joint venture with Quest as well. So thinking of it kind of as more care center and Walmart Health Center. And then we've announced 2 sites in Chicago as we think about the things that have happened after the civil unrest there. We're going to come back into those communities and offer low-cost healthcare. So we're thinking about it in a different model than CVS. And how do we get to more patients and have an interactive healthcare setting to where, and I've recently just taken over the dental, vision, and hearing business myself, but this is my third day in that job. So anyway, as you think about that, is how do you go from care setting to care setting as you think about kind of interoperability, but interoperable healthcare? So the dentist may refer you to the medical facility, and you can start to understand different disease states and how they interact together to be really total healthcare for the person. Mm-hmm. And so that's the way we're thinking of it.
50% of consumers would be willing to go to a Walmart for an MRI. So I think that the value-based model is resonating with consumers. They realize that healthcare is really, really important, and they're paying for more and more of it out of their pocket. And certainly we're seeing more and more of them that are willing to look for a newer, more efficient model.
It's critical in order for us to ensure that we're providing healthcare services, both in an accessible way, but also affordable. Affordability is, especially due to COVID-19, we're seeing that even more so being that much more critical. And so, as you had mentioned, Jeff, we recently announced that we're expanding our partnership with VillageMD. We've seen really great traction thus far. We'll be rolling out to over 30 markets over the next couple of years. And more than 50% of these clinics are going to be in medically underserved areas. And so that, similar to what David said earlier, we're focusing in on communities like Chicago, and other markets where there's a need for access to care. And we're excited just because it's comprehensive primary care versus, just acute needs, but having primary care so that they can take care of the total population of that patient. And we're leveraging our pharmacists as well with these clinics. And so what we've also tested out in Houston is we do have our Walgreens Health Outcomes pharmacists partnering with the primary care clinic so that they can manage not only what's happening in the primary care setting, but then once they leave and get their prescriptions, we have a pharmacist that's actually helping them manage their care after and ensuring that they stay adherent to therapy, and then coming back to the primary care physician to help acknowledge or identify any barriers to adherence.
The independents have always done a good job of reaching out directly to the prescribers in their communities. They've got more time to do it. They've got those long-standing relationships. So, kind of what we're supporting and encouraging through data tools and training and such is for those independents, because of their unique model, their connectivity with the patients at a very personal level, to create those relationships with the prescribers to be extenders, right? They may not be in the same physical space, but if when we connect them through technology, of course, we talked about that earlier, we connect them through that knowledge of that patient and being able to talk about that patient as they transition back and forth between the primary care or the specialist and the pharmacy. That's really where that I think that relationship blossoms there. Certainly, there's a lot more that the independents are going to need to do to enable that. But in a lot of cases, again, they're not going to have the footprint, they're not going to have the physical space to be able to build that, or quite frankly, the funding or the infrastructure.
I think what we're seeing, again, this entire movement from acute care to a more non-acute environment places pharmacy and pharmacists more centrally. You're going to see an increase in immunizations, obviously. I think flu itself, you're going to see an increase this year with immunizations, but over time you have COVID, increases as well. We'll see if that's a primary and a booster or just a primary. COVID testing is going to play into it. And, what we're focused on is going to be continuing, how do we take work out of their hands in terms of dispensing processes, and how do we put them in with time? I think that's the critical piece of this, is having the time to be patient facing, to do all of this and to maintain and manage that pivot, if you will, from acute to non-acute.
I do think this is the path forward for the professional pharmacy. Mm-hmm. It's still going to be a lot of work. It's not going to be easy, but I think we're all committed to that. So now's our time for sure.
Mm-hmm. Due to COVID-19, we've been able to understand how do you accelerate innovation may it be on the digital side, may it be what's happening in the store, and how do we alleviate a lot of the work that's happening so that we can have our pharmacists play this role that Jocelyn mentioned, may it be for testing, for immunizations, for MTM, adherence like services, consultations. I think one key component will be is what Steve mentioned. We need to get paid for our services. We need to ensure that we receive provider status. We will continue to innovate in this space, but until we get, there's value that's associated on the impact we're making, and we're able to be recognized as a provider, even if it's 85% of what's out there, it will inhibit our ability to move forward. So I do think that COVID-19 is a critical time for the profession, because we've tried for the last 15 years and we haven't had traction, but for the first time, we were able to get that win that Doug mentioned, to get the ability for pharmacists to administer, write for prescriptions and get tested and get paid. If we can extend that to flu, other test and treat, prescriptive authority at some point in the future, that will completely change how pharmacy is seen in the future. And I'm very excited about that. I think this is a time where we can all band together to help push for that. Where we might have not been heard before, I believe we're at a point right now where we can be heard because there's a need for that type of care.
One of the things I've been encouraged about, this discussion and everything we do, how united pharmacy is together. And, I think we need to be united moving forward. I said that, we're in a nonlinear world. We're facing disruption. I want to be the disruptor rather than the disruptee. Yeah, I saw last survey I saw was that 42% of the American people said that they will not be immunized once the vaccine becomes available. And I find that highly disturbing, like you do. Otherwise, our way of life is going to, not be what it once was. And we need to unite on this vaccine issue and speak with one voice. And if we do that, I'm pretty confident that, the future is brighter than ever for pharmacy.
I think that the proof is in the pudding, so to speak, in what we've demonstrated. And I just want to piggyback on what Rena said. This is the catalyst for change. And we've got to take this, to a place where retail pharmacies, too much of the revenue share has been generic dispensing, which is not long-term sustainable for them. And it's got to move into more of these clinical services so that their business model keeps them available to protect Americans in their everyday healthcare. We need them.
There's a narrative in our industry or in the broader industry that the physical pharmacy is going to disappear in 5 years and everything's going to be digitized and everything's going to be mailed to their home. I think what you're seeing with COVID is this critical presence of pharmacy that's required and that's needed. And I think you're seeing that from the population. I'm sure all of you get the same thing. There isn't a day that doesn't go by that I don't get an update of what the consumer perception is of COVID. But the one thing that I read in all of them is, yeah, we do want to go see our provider and our pharmacist in person now. And so there is this sort of shift to say digital is not everything. The physical structure and a pharmacist being there, a physician being there is necessary. And it is something that we are now desiring. So I do think that this whole critical presence of pharmacy is what's coming up and bubbling up from this COVID situation.
And that concludes our discussion. I'd like to thank our panelists for sharing their insights about the future of retail pharmacy, and thank you for watching.